welcome all to this webinar, and thank you to the AUHC team and the LightCastle team for organizing this webinar. And thank you to all the panelists as well, and the moderators who will be joining us today. We are looking forward to a great discussion today on the topic. Uh, In fact, if I may start, USAID, in fact, USAID is proud to have partnered with the government of Bangladesh for the past 50 years. And we have supported Bangladesh to drastically reduce child and maternal mortality, improve family planning access, improve nutritional status, reduce tuberculosis mortality, etc. So more recently, we have supported the Ministry of Health with a very robust COVID-19 response. I hope many of you know about that, including the US government donation of over 85 million vaccines, and many of which are being pushed into the arms of the people we love and know. We've addressed all the easy issues, basically, I would say. But now we have to work on the more challenging bits because we need to now build the health system and ensure that equitable access is given to and through affordable, high quality health services to the people. So over the years, USAID has supported the public sector to ensure quality healthcare for the people, as well as the non-government and the private sector. So you've heard about the Smiley Sun Clinic. That is one of the private sector initiatives that we have done, which used to be an NGO model back in the days since 90s. So that has been supporting the people
Fida bhai, you have become mute. Can you unmute yourself?
Sorry, when was I mute?
Just for 5 seconds. It's fine.
Sorry, I didn't notice. Anyway, okay. So yeah, thank you. So so basically, USAID has been supporting the Smiling Sun Network, which is a private sector model, which used to be an NGO model back in the days since 90s. So that was donor funding supported, but now there is a social enterprise company. And we are proud to have the CEO of Shuja Hashi Network today with us, who will obviously be participating in the panel discussions. So that has, they are now a company that, and they are moving forwards toward attracting diversified funding and partnerships so that they can become fully sustainable. So this is soon to be success story on our side. Another successful venture that we have had from USAID is the social marketing company, which is a very known household name to many. So that started as a USAID family planning social marketing project in the 70s, but that now stands strong as a self-sufficient multi-million-dollar private company. And it still serves the poor with affordable quality commodities and preventive services. So that means that it's still possible to address development needs as well as do business at the same time. So Bangladesh, as you know, is progressing towards lower middle income country status, and USAID wants to support the national health system with sustainable solutions, using resources that exist in both the public and private sectors to improve the health and livelihoods of the people of Bangladesh. USAID wants to build bridges, connections, platforms, and networks to build the health sector and leverage resources from multiple sources. And that can reach people from all socioeconomic conditions with quality, affordable healthcare in all geographies of the country. USAID believes that there are many opportunities for private sector entities to play a role uh, in improving the health service access, quality, and affordability to result in financially and programmatically sustainable models. Some of these solutions could stimulate the private sector and job creation, and some could improve efficiency of public resources. We need to work together to identify the win-win public-private solutions that can achieve the overall objective of meeting the population's health needs. So USAID is working with the government to identify the policy barriers and surveying the private sector for initiatives capable of driving systemic change, informing new policies, and developing strategies to support improved availability of quality, affordable services and products. USAID wants to urge the private sector and also the primary healthcare network private sector entities to look for opportunities of potential investment, partnership, which I'm sure will be discussed at length today. USAID's focus is to ensure sustainable systems that can move to innovative and diversified financing models as donor funding begins to decline, which is inevitable, and that shift away from service delivery support from with the donor funding support. So we need to cover that through these innovative financing models, and I hope there will be a very productive discussion today on this topic. And we'd like to encourage the private sector and the healthcare startups to work together, to be involved, and create strong networks, engage with one another, and seek opportunities for funding and partnerships with healthcare and livelihood service providers so that we can create a sustained, lasting development